recent tweet, Dr. Adams wrote how he used to be one of the CDC's most ardent defenders. And he said this, quote, "I never dreamed the day would come when I would advise people not to follow their guidance." Dr. Jerome Adams is here with me now. He's the former U.S. Surgeon General and Executive Director of Health Equity Initiatives at Purdue University. Dr. Adams, thank you for being here. You are not sitting by quietly, as some people do after they leave government. It seems you think the CDC kind of botched the new isolation guidelines. Given the chance, how would you fix it?
Well, my approach is always to give people the same advice that I would give to my family. And when it was don't wear a mask, that was the same advice I was following based on what we thought we knew about the virus at the time. And when it comes to this new isolation guidance, there is no one. I've talked to people at the CDC. I've talked to people who work in the current administration. There is no one who would actually follow this advice and let someone in their home on day 6 if they had resolving symptoms after a positive COVID test. What I've said to people and what I personally recommend to my family and friends and what I would do is make sure you would have a negative antigen test, preferably 2 negative antigen tests 2 days apart before you would end isolation. And the challenge with the administration is they don't have the test to actually make that happen, so they're not going to put out a policy from a political standpoint that reflects poorly on their inability to provide tests. But that doesn't mean that that's not the right thing to do or the thing that they would do for their own families.
Oh, I hadn't thought of image maintenance. Let me play a little bit of sound here real quick and some new information that we got today. So pretty much right now what you're getting to is asymptomatic adults in the U.S. with COVID can leave quarantine after 5 days.
Not just asymptomatic. The guidance says resolving symptoms. It's important to remember it's not just asymptomatic. The guidance says resolving symptoms. And you could have a cough still, and as long as it's better than what it was yesterday, you still would fit under their guidance.
Okay, got a cough, got the sniffles, you can get back out there. You have to wear a mask for 5 days. And when asked why no test was required, the CDC director said this initially.
Now, the question of why we didn't include a test there is simply because we know that PCRs can stay positive for up to 12 weeks. So we would have people in isolation for a very long time if we were relying on PCRs.
A PCR test, we know, Dr. Adams, can pick up, some teeny tiny particle stuffed away in your nasal cavity. And that could mean for 12 weeks, airlines, hospitals, businesses, they're crippled. But you say, no, forget that. Rapid tests are key. Why?
Exactly. What people need to understand is there are 2 main kinds of tests. There's the PCR test, and that can pick up dead virus particles up to weeks out from when you're no longer infectious. But what we're talking about here are the rapid antigen tests, the at-home tests. And those tests really only turn positive if you are actively able to spread virus, if you have replicating virus in your system. So that was, quite frankly, a little bit disingenuous of an answer from the CDC director because no one is calling for a PCR test out of isolation option. What we're saying is that you should have at least 1 and preferably 2 negative rapid antigen tests to get out of isolation so as to protect yourself and protect the people around you.
Communication is an issue, I'm going to put it that way, and respectfully, there were some pretty difficult situations during the Trump administration when you were on board as well, that this is a really wily problem. We're talking about 300+ million people, so it's difficult. But a law professor tweeted this. She was just summarizing kind of what people are hearing. She said, stay indoors, but also return in person. Wear a mask. Not that one. The expensive one that you can't find. Take rapid tests, which you also can't find. But if you find them, don't buy them. Rapid tests don't work. You need PCR. There are 0 appointments in your area. People are exhausted.
It's incredibly frustrating.
Do you worry at some point that Americans are just going to tune out the medical establishment?
Well, I absolutely do, and that is why I've been pushing back. So you're right. We had challenges, and that's why I'm speaking out, because I understand the challenges when you have to balance the politics, the science, the actual supply chain. But what I always tried to do was say, here's what the science says is your best option. Here's what you should think about in terms of options in your risk if you can't do what we recommend as the #1 option. Another example is masking. And the CDC director has said in the guidance that you should wear a mask for 5 days, even though we know that people don't have access to high-quality filtration masks like N95s and KN95s, and that most people aren't wearing masks anyway. So you have to balance the science with pragmatism, but you've got to be honest about why you're doing it. And in the administration's case, it was clear they were doing it to preserve the workforce, which is fine, but don't say that it's the science that's leading you to make that decision when it's really the supply chain and the workforce.
You've kind of alluded to a few times that maybe science has gotten in the back seat a few times, or that PR or image are becoming more important. Do you think that Rochelle Walensky should step down?
I know Dr. Walensky from conversations that we've had. She's a good person. She's in a very difficult situation. I'm the last person to sit here and say that someone should step down, but I think they really do need to figure out their messaging. They really do need to speak to the science. And when they make a mistake, they need to own it and correct it. In the case of isolation, she really does need to correct what she said about PCR tests, because it's hurt people's belief and faith and trust in the entire testing process. And they need to have a test out of isolation option, because that is what they would do before they would let someone come into their home or around their family.
One final thing here, it's kind of off the beaten path maybe, but you tweeted about this. As Surgeon General a few years ago, you told Americans, and at the time we didn't have a vaccine, the very best way that you can help yourself, that you can avoid a severe case of COVID, was to lose weight. We know that age and obesity, those are the biggest risk factors right now. Age you can't do much about. Obesity, you know, is a little more within your control. And you said you were called an Uncle Tom, that you were told you're victim blaming people, you were disparaged. And now mainstream media is starting to acknowledge this is a serious role obesity plays right now. Why did you feel so strongly about that issue?
Well, from my standpoint, it's important that people know America's core underlying health really has contributed to how hard we've been hit with this pandemic. The number one predictor of who's been hospitalized or who dies from COVID has been whether or not you're obese or morbidly obese. And so we need to both help people understand what they can do right now, and vaccination is important, but the administration seems to have taken a vaccination as our number one, our primary thing that we're going to talk about. We also need to help people understand that getting outside and exercising, better eating habits, even treatments that are available, like monoclonal antibodies and these new oral antivirals. These are all part of our toolkit for staying safe. Vaccinations are incredibly important, but there are so many other things that we could be doing to protect ourselves against COVID and against heart disease, against cancer, against diabetes, against these other killers out there that, quite frankly, kill more people than COVID. More people died from uncontrolled high blood pressure last year than died from COVID. And so if we improve our diet, we're going to help people out in many ways.
Dr. Jerome Adams, thank you very much.
Thank you. Get your vaccine, get your booster, mask up, and go out and exercise if you can. Lose a little weight if you can. It's the beginning of a new year, a great time to explore your health and to make some healthier choices.